Hello, everyone. Welcome to the LAMP Protocol for Depression. We shall take up the following Western and Chinese concepts: etiology, pathology, acupuncture and auriculotherapy, and the protocol. Depression accounts for 35 to 40% of all psychiatric illnesses. It is twice as common in women as in men. The onset of depression increases towards middle age, with the maximum onset in the 55 to 60 age group. Mental health has long been considered a sensitive topic in the Philippines. As a country with a substantial Catholic population, depression and anxiety can sometimes be associated with a lack of faith. However, this perception has continuously been challenged recently, especially as the younger Filipino generation has become more open to discussing their frustrations, feelings of burnout, and hopelessness. For 2023, the National Center for Mental Health in the Philippines received a budget allocation amounting to approximately 2.15 trillion Philippine pesos, indicating a significant increase from the previous year's budget. The NCMH is responsible for implementing programs and policies on mental health in the Philippines. The Philippines lacks epidemiological data on depression among young adults. About 1 in 10 Filipino young adults experience moderate to severe depression. The prevalence of moderate to severe depression in Filipino young adults is higher among females than males. Less education, residence in urban areas, and marital problems are significant predictors of moderate to severe depression. Moderate to severe depression is significantly associated with suicidal ideation. At least 3.6 million Filipinos are battling mental health issues as the Philippines continues to grapple with the COVID-19 pandemic. About 1.14 million Filipinos have depression, 847,000 are battling alcohol use disorders, while 520,000 others were diagnosed with bipolar disorder. Depressive illness that is predominantly determined by genetic constitutional factors is referred to as endogenous depression. This is characterized by being worse in the morning. Depressive illness that is predominantly a reaction to external influences is referred to as reactive depression. The main symptoms and signs of depression are painful thoughts, a feeling of sadness, anxiety, and agitation, loss of interest, loss of self-esteem, derealization and depersonalization, hypochondriasis, disorders of perception, insomnia, loss of appetite, diurnal variation, worse in the morning. The Mayo Clinic gives a detailed description of the clinical manifestations of depression. This clinic considers two main symptoms to be the hallmarks of depression: loss of interest in normal daily activities, depressed mood, feeling of sadness, helplessness, hopelessness, crying. The Mayo Clinic also considers the following signs and symptoms, which must be present for at least 2 weeks, as essential to diagnose depression: sleep disturbances, impaired thinking or concentration, changes in weight, agitation, fatigue or slowing of body movements, low self-esteem, feelings of guilt, loss of interest in sex, thoughts of death. The Mayo Clinic distinguishes the following types of depression: major depression. This type of mood disturbance lasts more than 2 weeks. Symptoms may include overwhelming feelings of sadness and grief, loss of interest or pleasure in activities you usually enjoy, and feelings of worthlessness or guilt. This type of depression may result in poor sleep, a change in appetite, severe fatigue, and difficulty concentrating. Severe depression may increase the risk of suicide. Dysthymia is a less severe but more chronic form of depression. Signs and symptoms usually are not disabling, and periods of dysthymia can alternate with short periods of feeling normal. Adjustment disorders. This is a feeling of depression elicited by external events, mostly to do with loss. For example, death of a loved one, loss of a job, a diagnosis of cancer. People who cannot adjust to such a loss suffer a feeling of depression, which is called adjustment disorder. Seasonal affective disorder, SAD, is a pattern of depression related to changes in seasons and a lack of exposure to sunlight. It may cause headaches, irritability, and a low energy level. A major depressive syndrome has four main aspects: a particular set of symptoms, it has no organic factor, and is not the normal reaction to the death of a family member. There are no delusions or hallucinations in the absence of mood symptoms. It is not superimposed on schizophrenia, delusional disorders, or psychotic disorders. The main symptoms of major depressive syndrome are depressed mood most of the day, nearly every day; markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day; significant weight loss or gain, decrease or increase in appetite, insomnia or sleepiness; psychomotor agitation or retardation every day; fatigue nearly every day; feelings of worthlessness or guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being ill; diminished ability to think or concentrate, indecisiveness nearly every day; recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. According to Seligman, depression is characterized by a feeling of helplessness. Principally, the issue about which a person feels helpless is his ability to make and to maintain affectional relationships. The feeling of helplessness can be attributed to experiences in the family of origin from childhood to adolescence. He is likely to have had the bitter experience of never having attained a stable and secure relationship with his parents, despite having made repeated efforts to do so. These childhood experiences result in developing a strong bias to interpret any loss he may later suffer as yet another of his failures to make or maintain a stable affectional relationship. He or she may have been told repeatedly how unlovable, inadequate, and or incompetent he or she is. These experiences would result in developing a model of him or herself as unlovable and unwanted, and attachment figures are as likely to be unavailable, rejecting, or punitive. Whenever such a person suffers adversity, far from expecting others to be helpful, he or she expects them to be hostile and rejecting. He or she is more likely than others to have experienced actual loss of a parent during childhood. Therefore, the particular pattern of depressive illness that the person develops will turn on the particular pattern of childhood experiences he or she has had. Exposure to such experiences in childhood also explains why, in individuals prone to depression, there is a strong tendency for the sadness, yearning, and perhaps anger aroused by a loss to become disconnected from the situation that aroused them. Western and Chinese medicine concepts of depression. We have here the correspondence between Chinese mental emotional conditions and depression in Western medicine. The complex of symptoms that we call depression in the West corresponds not to one, but to at least 5 main categories of mental emotional disturbances in the classics. Lilium syndrome. The patient wants to eat but is reluctant to swallow food, unwilling to speak. He or she wants to lie in bed but cannot lie quietly as he or she is restless. He or she wants to walk but is soon tired, cannot tolerate the smell of food. He or she feels cold or hot, rapid pulse. Agitation, Zhangzhao, literally meaning visceral restlessness, was first mentioned in the essential prescriptions of the Golden Chest. Plumstone syndrome was first described in the essential prescriptions of the Golden Chest. The etiology of this syndrome is emotional and is due to depression. What we translate as palpitations and anxiety corresponds to 2 separate conditions in Chinese medicine. The first is fear and palpitations, the second, panic throbbing. Both these conditions involve a state of fear, worry, and anxiety. The first with palpitations and the second with a throbbing sensation in the chest and below the umbilicus. Both fear and palpitations and panic throbbing may accompany depression, and we shall refer to these 2 conditions collectively as anxiety and palpitations. Liver qi may be deficient. In physiology, liver qi rises in coordination with the descending of lung qi. The descending of lung qi partially depends on the ascending of liver qi. Liver qi ascends to the heart. Liver qi deficiency usually occurs in conjunction with liver blood deficiency, and the clinical manifestations of liver qi deficiency include all those of liver blood deficiency plus depression. A deficiency of liver blood and liver qi leads to insufficient movement of the ethereal soul and therefore to depression, lack of inspiration, lack of life dreams, and confusion about a sense of direction in life. A deficiency of liver qi also implies a deficiency of the gallbladder, leading to timidity, depression, lack of resolve, and an inability to make decisions. Etiology of depression in TCM. Emotional stress is the main etiological factor in depression. The main emotions that may give rise to depression are anger, sadness, grief, worry, and guilt. Anger, intended in a broad sense to include frustration, resentment, and hatred, causes either liver qi stagnation or liver yang rising. When it is suppressed, it is more likely to cause liver qi stagnation and depression. Liver qi stagnation is a frequent cause of mental depression, especially in its beginning stages. Liver qi stagnation causes depression by restraining the coming and going of the ethereal soul, therefore resulting in a lack of ideas, projects, aims, inspiration, and a general lack of sense of direction in life. One of the most significant and important signs of liver qi stagnation is a wiry pulse. If the pulse is generally wiry in all positions, it is always a definite sign that the mental depression is due to liver qi stagnation. Often, the pulse picture contradicts the first appearance of the patient. In fact, the patient may appear depressed, slow in movement, and pale with a weak voice, all signs pointing to a deficiency as the cause of the problem. But the pulse is full and wiry in every position. This is a sure sign that the depression is due to qi stagnation. Indeed, in some cases, and especially in men, the person may seek treatment for tiredness as his main complaint. But if the pulse is full and wiry in every position, it almost certainly indicates that the person is depressed with liver qi stagnation as the main cause of it. Sadness and grief initially deplete qi and therefore lead to qi deficiency of the spleen, heart, and lungs. However, after some time, the deficiency of qi impairs its circulation and leads also to some qi stagnation. This is a qi stagnation that affects not the liver, but the heart and lungs. The heart and or lung qi stagnation also affect the ethereal soul and restrain its coming and going, resulting in a lack of ideas, projects, aims and inspiration, and a general lack of sense of direction in life. Sadness and grief are frequent causes of depression from loss of a family member or partner through death or separation. This is called reactive depression in Western psychiatry. Worry knots qi, which means that it causes qi stagnation. Worry causes stagnation of qi of the spleen, lungs, and heart. Worry also affects the liver and may cause either liver qi stagnation or liver yang rising. The heart and or lung qi stagnation also affect the ethereal soul and restrain its coming and going, resulting in a lack of ideas, projects, aims and inspiration, and a general lack of sense of direction in life. Guilt is a common cause of qi stagnation. It affects primarily the heart and kidneys. The heart qi stagnation also affects the ethereal soul and restrains its coming and going. As guilt also affects the kidneys, it weakens the willpower, the weakness of which is an important feature of depression. Constitutional traits play an important role in the etiology of depression. For example, a constitutional deficiency of the kidneys with its resulting weakness of the willpower is a frequent underlying background for the development of depression. A constitutional tendency to heart patterns is also an important contributory factor to the development of depression. The most important and reliable sign of a tendency to emotional problems is a midline heart crack on the tongue. Diet plays a secondary role in the etiology of depression. It contributes to the development of depression in the presence of emotional stress. Excessive consumption of dairy foods, sweets, sugar, and bread may lead to the formation of phlegm. Phlegm may become a contributory pathological element of depression because, first of all, it impairs qi, and would therefore aggravate any deficiency and stagnation of qi. It is also obstructive and heavy and therefore would cloud the mind, leading to mental confusion. This condition would aggravate a condition of restraint of the ethereal soul. A dietary contributory factor in the development of depression is a diet lacking in nourishment. This occurs when patients follow strict slimming diets or when they apply a vegetarian diet inappropriately. This leads to deficiency of qi and blood, which are the conditions underlying deficiency types of depression. Overwork, in the sense of working long hours without adequate rest for several years, leads to kidney deficiency, and this often forms the background for depression in older people. The pathology of depression usually starts either with qi stagnation or with a combination of qi stagnation with qi deficiency. Qi stagnation affects not only the liver, but especially in depression, it may affect also the lungs and or heart. Although the term yu means both stagnation and depression, that does not mean that there is always qi stagnation in depression, as initially there may be only qi deficiency. When qi stagnation persists, it leads to heat, and this manifests with a slight redness on the sides of the tongue if the heat is in the liver, on the sides, chest area if in the lungs, and on the tip if in the heart. Phlegm is a very common pathogenic factor in depression. Phlegm is formed not only when there is a deficiency of qi of the lungs, spleen, or kidneys, but it may also derive from qi stagnation. Long-term qi stagnation may lead to blood stasis, in which case the tongue will be purple. When heat persists for a long time, it may injure yin and lead to yin deficiency of heart, lungs, stomach, spleen, liver, or kidneys. When yin deficiency goes on for a protracted time, empty heat is generated, and in this case, the tongue will be red and without coating. Now let's discuss the elements of the pathology of depression. The willpower is impaired. There is a lack of willpower, drive, initiative, enthusiasm, and momentum to break out of depression. And let's discuss the points that can help strengthen the willpower. Bladder 23 strengthens and warms the patient's jing. Depletion of jing can give rise to a depletion of energy, wisdom, determination, willpower, and drive. Bladder 52, particularly good for water causative factors as it strengthens the spirit of kidney, which, if weakened, can hold a person back from fulfilling their life's plan, gets directly to the will. Kidney controls the qi we are born with. Therefore, this is a good point to consider for someone with a weak hold on life, or who is weak-willed, or conversely, if a person is ruthlessly overambitious. Kidney 3 calms the type of exaggerated fear that imbalances in the water element can sometimes produce. Consider kidney 3 for lack of will for those who are excessively driven or for hypertension, often tender upon palpation if unbalanced. The real benefit for ear acupuncture is that the projection of body meridians onto the ear can be used to access essential body acupuncture points via the ear. It is now possible to strengthen an organ, not just by means of its organ point, which is tonification point on the ear, but by including the source point as well, and either the transverse or the longitudinal luo point if needed. All this can be accomplished without having to switch between ear acupuncture and body acupuncture because treatment is exclusively performed on the ear. For example, the ear point corresponding to the source point of an organ is indeed found to be electrically active when the symptoms suggest that it may be in need of treatment. So here you have the corresponding location on the ear of the bladder 23, bladder 52, and kidney 3. The ethereal soul does not come and go enough, which may be from stagnation or deficiency. There is a lack of plans, ideas, life dreams, hope, inspiration, and a sense of direction. The following points can help. Gallbladder 40 helps bring perspective in a person's life, particularly on the mental and spiritual levels. If we are lost and climb a hill, in this case a burial mound, we can see where we are. Helpful for decision making and brings clarity. For those who sigh a lot, This point strengthens the wood official and thus a person's resolve, and as such can be helpful for timidity. Bladder 47 relates to the hun, the spiritual aspect of the liver. It roots the ethereal soul and brings calmness, acceptance, and tolerance to the core of a person. The hun influences our ability to imagine, plan, and have intuition and hope in our life. Use bladder 47 when a patient is depressed, irritable, angry, resentful, bitter, or snarled up. Good for recovering alcoholics or drug addicts. So we have here gallbladder 40 and bladder 47 on the ear. The mind and spirit in general is affected with angst, anxiety, despair, and sadness. The following points can be helpful. Do 24 calms the mind and spirit in a powerful way. Can be used in cases of extreme mental disorders, for example, schizophrenia, obsessive thinking patterns, loss of uprightness and decorum. Can be combined with GB13 or yin tang to augment its effect in calming severe anxiety or fear. REN 15 is a helpful point for panic attacks, particularly when loved ones are involved, and for aiding drug withdrawal, including tobacco. Heart 7. Consider where there is no will to go on, chronic sadness or lack of spirit, indicating the gate may be closed. Treatment in these cases is usually tonification. The patient may be experiencing hallucinations, exceedingly high spirits, or uncontrollable talkativeness, indications that the gate may be stuck open. Treatment is usually sedation. Can be effective for palpitations, arrhythmia, effects of a broken heart, insomnia, worry, or anxiety. It irks and strengthens the heart when it is jittery. Consider for shock at some level, which is characterized by uncontrollably bursting into tears, desperation, panic, hysteria, or deep exhaustion. So these are the ear equivalents for DO 24, REN 15, and Heart 7. The constriction of the corporeal soul gives rise to morbid thoughts of death. DO 24 can be combined with GB13 or yin tang to augment its effect in calming severe anxiety or fear. Bladder 13, suicidal, consider for long-standing grief. DO 12, desire to kill people, can augment treatment on the lungs, and for this reason it can also be helpful for long-term grief and sadness. Bladder 42, 3 corpses flowing when there is grief or lack of quality in the patient's life. For severe or profound depression, those with suicidal feelings, lack of physical vigor and dexterity, no sense of purpose, feeling worthless. So here are the ear equivalents for DO 24, bladder 13, DO 12, and bladder 42. The intellect is affected by overthinking, giving rise to obsessive thinking, pensiveness, and brooding. GB15, considered for those who are unable to cry. This powerful point can bring a great release to the patient through the shedding of tears. Bladder 49 for obsessional thinking, or where worry, poor memory, or lack of concentration predominate. These are the ear equivalents for GB15 and bladder 49. Deficiency of the gallbladder's courage leads to indecisiveness and timidity. GB40 helps bring perspective in a person's life, particularly on the mental and spiritual levels, helpful for decision-making and brings clarity. This point strengthens the wood official and thus a person's resolve, and as such can be helpful for timidity. DO 20 calls upon our innate wisdom and knowledge and can bring everything together if a patient is fragmented, disconnected, chaotic, or severely agitated. It connects to the deep pathway of the liver and thus can be effective in cases where anger, frustration, depression, or lack of vision predominate. So here are the ear points for GB40 and DO 20. Affliction of the pericardium and triple burner leads to problems in forming or maintaining relationships. TB5, the third gate on the meridian, regulates the balance of heat within a person, which can manifest as physical or emotional coldness, or conversely as excessive openness. Helps with relationship difficulties, especially if a person is feeling insecure or vulnerable. Pericardium 7. Consider when the patient is suffering from insecurity, vulnerability, sadness, rejection, or lack of joy, particularly when associated with relationship difficulties. Consider when there is hysterical laughter or crying, or where mania or nervous panic is being exhibited. Pericardium 6, useful in cases of anxiety, sadness, or lack of joy, perhaps as a result of relationship conflicts. Ren 17. Consider this point when all the C's are depleted or a person is sad, tired, or frustrated. So those mentioned are not alternative pathologies of depression, but aspects of its pathology. Although not all of them need to be present, most of them usually are. So here are the ear points for TB5, P7, P6, and Ren 17. Now let's discuss the acupuncture or auriculotherapy for depression. Lung 7 helps to enable the release of tears if suppressed by chronic grief and sadness. Lung 7 brings clear qi up to the head and promotes a descending of turbid qi from the head. On a physical level, this means that Lung 7 can treat problems of the nose and sinuses. On a psychic level, it clears the mind and lifts mood. Use it for most types of depression, whatever the pattern involved. Lung 3 is considered for mental confusion, severe depression, claustrophobia, agoraphobia, or forgetfulness. Large intestine 4. The patient may experience a physical or emotional discharge after treatment, as it eventually brings calmness to the system. LI4 is forbidden throughout pregnancy. It assists the patient in letting go on all levels, but especially with sadness, grief, or a sense of loss, thus allowing in those things of value. When used with liver 3, a protocol known as the Four Gates, this point can have a wonderful effect of calming the patient on the levels of body, mind, or spirit, strengthens the defensive qi. Stomach 36 lifts mood in patients who are depressed against a background of qi and blood deficiency. So this is for nervousness or extreme agitation. Stomach 40 is one of the main points in TCM to resolve and clear damp and phlegm from the system, and thus can help with mental fogginess and confusion, lethargy, poor memory, worry, or obsessive thinking. Heart 5 enables a deeper connection to be made with the patient, helps to see further beyond the mask, enables the patient to be more in touch with their real self. Heart 5 is a peaceful point that gives strength and stability to a person shocked or traumatized, aids clear thinking and communication, helps maintain emotional harmony. Heart 7 is considered where there is no will to go on, chronic sadness or lack of spirit indicating the gate may be closed. Treatment is usually tonification. The patient may be experiencing hallucinations, exceedingly high spirits, or uncontrollable talkativeness, indications that the gate may be stuck. Consider for shock at some level, which is characterized by uncontrollably bursting into tears, desperation, panic, hysteria, or deep exhaustion. Treatment is usually sedation. Bladder 15 is for anxiety, shock, effects of a broken heart, insomnia, or sadness. Bladder 42 is used when there is grief or lack of quality in the patient's life for severe or profound depression like suicidal feelings, lack of physical vigor and dexterity, no sense of purpose, feeling worthless. Bladder 44 gets in touch with the spirit of heart when the person is suffering from shock, feeling downhearted, hard-hearted, broken-hearted, disheartened, lacking in joy, or experiencing sadness. For long-standing grief over bereavement, lost love, broken ideals, or where the patient has been deeply wounded emotionally. Using this point is like taking the patient into a hall where the spirit resides. As practitioners of this subtle and wonderful medicine, we need to work on being in touch with our own spirit when addressing any point, but particularly spirit points. Bladder 47 is used when the patient is depressed, irritable, angry, resentful, bitter, or snarled up. Good for recovering alcoholics or drug addicts. Consider when there are feelings of leaving the body when going to sleep, because it grounds the hun and is said to help with excessive dreaming, thereby aiding better quality sleep. Bladder 52. Kidney controls the chi we are born with. Therefore, this is a good point to consider for someone with a weak hold on life or who is weak-willed, or conversely, if a person is ruthlessly over-ambitious. Kidney 3 is considered for lack of will, for those who are excessively driven, or for hypertension, often tender upon palpation if unbalanced. Kidney 9 can be effective in supporting the patient as they strive to deal with problems or situations that confront them in life. Consider when the heart and kidney energies are not harmonized, and for psychological symptoms such as mania, madness, or excessive anger. Pericardium 6 is useful in cases of anxiety, sadness, or lack of joy, perhaps as a result of relationship conflicts. Triple burner 3 is for fevers and emotions that rage and then subside, for lack of balance and control. Has a connection to the area of Do 20, and thus both points can be considered for raising the spirits. GB 13 settles epilepsy, madness, jealousy, anger, obsessive thinking, and suspicion. It can strengthen a person's ability to be more assertive, present, and decisive. Liver 3 is particularly effective when sedated for a person who is tense, overexcited, easily angered or annoyed, agitated, or tightly wired. Do 4 is considered early on in treatment for bringing back vitality and energy to a person who is lifeless, cold, with no joy in life. Do 11 is often combined with Do 10 in order to strengthen the patient's spirit and to support their own deeper personal development. Do 12 helps support the patient at a deep level. It's like a pillar for the spirit. It can augment treatment on the lungs, and for this reason, it can also be helpful for long-term grief and sadness. Do 14. This powerful point can bring a resurgence of strength and vitality to a person's energy system. Good when there is distress of the mind and spirit, particularly if the heart is deficient, giving rise to problems such as depression, sadness, or insomnia. 216 is effective in treating the patient at the spirit level. It can clear the head and bring perspective to their life and aid the integration of body, mind, and spirit. Do 19 is commonly used together with Do 20 when the pulse picture is chaotic and the patient is severely agitated and disturbed. Do 20 calls upon our innate wisdom and knowledge and can bring everything together if a patient is fragmented, disconnected, chaotic, or severely agitated. Do 24 can be used in cases of extreme mental disorders, for example, schizophrenia, obsessive thinking patterns, loss of uprightness, and decorum. It can be combined with GB 13 or in-time to augment its effect in calming severe anxiety or fear. REN 4 is helpful for sorting out problems because of its connection to small intestine. When used with REN 14, REN 4 can help re-establish the junction or heart-kidney link when this has been disturbed by severe shock or emotional turmoil. REN 15 can be a helpful point for panic attacks, particularly when loved ones are involved, and for aiding drug withdrawal, including tobacco. So this is a table showing us the interesting correlation between the most common symptoms and patterns. So as we can see, the most common pattern is liver qi stagnation, followed by combination of liver qi stagnation and spleen qi deficiency, liver qi stagnation with phlegm. The LUMP protocol. We determine the patterns, treatment principles, and treatment strategy by emphasizing differentiation of signs and symptoms and pulse and tongue evaluation as traditionally performed in the 8 principles model. We begin with the premise that liver qi stagnation and inability of the heart to store the shen properly underlie the disharmony in most cases. We determine to what extent this is true and explore whether the stagnation is affecting other viscera and whether the shen disturbance is due to deficiency or excess mechanisms. Based on the information gathered, we assess to what extent the pattern is characterized by yang features, psychomotor agitation, dream-disturbed sleep, irritability, and develops along the yin deficiency yang excess continuum. We determine the extent to which the pattern is characterized by yin features, psychomotor retardation, fatigue, hypersomnia, and develops along a deficiency of qi-yang excess of yin continuum. The involvement of each viscous and bowel is analyzed as well. The LUMP AcuWellness practitioner performs a Chinese medicine assessment using the intake form as a guide to gather information about the signs and symptoms, inquiring verbally about problem areas. Tongue and pulse evaluation helps determine the disease mechanisms and patterns involved. Abdominal palpation and assessment of the channels assist in focusing the diagnosis. The LUMP practitioner arrives at a set of treatment principles to address the pattern or combination of patterns by focusing on 4 features: liver qi stagnation, shen disturbance due to either deficiency or excess mechanisms or both, deficiency of qi-yang and or accumulation of dampness or phlegm, deficiency of yin blood and or hyperactivity of heat or fire. After using conventional Western assessment techniques to diagnose major depression and to exclude other relevant conditions, we perform a differential diagnosis on all participants entering the treatment. The differential diagnosis is accomplished by using the traditional method of the 4 evaluations. And we have the basic procedure. A questionnaire is administered. In the first section, we ask about the precipitating factors, previous history of depression, and the person's unique experience of being depressed. We aim at getting a clear sense of the person's constitutional tendencies, the psychosocial nature of their depression, and how their lifestyle has influenced their health. It is in this section that we make the most use of the 6 great units, the 5 phases, and the 8 principles to understand constitutional tendencies. In the second section of the questionnaire, we focus on differentiating the symptom criteria for major depressive episode, DSM-5, on the basis of our theoretical framework. Special attention is paid to how the symptom criteria correspond to liver qi stagnation, shen disturbance, and deficiency or excess of yin and yang. During the interview, the LUMP practitioners probe the questions in detail to differentiate disease mechanisms and pattern combinations clearly. For women, we take an in-depth gynecological history, including menstrual cycles, pregnancies. We conclude by inquiring about the emotional nature of the patient's complaints and the current specific manifestations of the depression. Pulses are taken in the traditional fashion. We have found it helpful to perform abdominal palpation following the traditional Japanese system. We also encourage palpation of the channel pathways and zones when making the final selection of points. Assessment of tongue is based on tongue diagnosis in Chinese medicine. We follow traditional observation of patient's demeanor and features, face color, eye expression, shen, etc. We use a total of 7 acupuncture points and 3 auricular points. Select the 7 acupuncture points from a set of 5 main points that together address appropriate combination of 4 main features: liver qi stagnation, shen disturbance due to deficiency or excess, deficiency of qi-yang, blood yin, dampness phlegm, or hyperactivity of yang. Select at least one of the 2 remaining points to regulate Du channel or directly affect mental functions, that is, Du 24 or GB18, and the other point to address the pattern differentiation further. Select 3 auricular points from the list provided to further address damage by the emotions. Treatment course consists of 12 acupuncture treatments given over an 8-week period, bi-weekly for the first 4 weeks and weekly during the next 4 weeks. It is strongly advised to follow the acute treatment phase with maintenance treatments. Maintenance may involve 2 acupuncture treatments per month for 3 months, then 1 treatment per month for the following 12 months with a seasonal tune-up treatment every time the season changes. Thank you very much for your attention.